Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders in the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.aaai.org. Today's edition of our Conversations from the World of Allergy podcast series is very timely and will be relevant for both healthcare professionals and patients alike. Today's guest is Dr. Thanai Pongdee. Dr. Pongdee is an assistant professor of medicine in the Division of Allergic Diseases at the Mayo Clinic in Rochester, Minnesota, where he serves as the research chair and as an associate fellowship program director. Dr. Pongdee's research interests focus on mast cell and hypereosinophilic disorders. He's been very active within the American Academy of Allergy, Asthma, and Immunology for a very long time and currently serves on the board of directors. He's also served several leadership roles in the asthma diagnosis and treatment intersection. Dr. Pongdee, thank you so much for taking time to join us and welcome to the podcast.
Very happy to be here. I very much appreciate the opportunity to talk today.
Yeah, your perspective is going to be very helpful, and this is it's a bit of an interesting situation. We generally try to avoid using brand names for medications, especially during CE events and things like that, unless there are no generic equivalents available. But that's kind of unavoidable for today's conversation, as we'll talk about. So, can you just tell us a little bit about the medication called Flovent, such as how long it's been available, the conditions it's used to treat, and other information?
Yeah, so Flovent is the brand name for an inhaled corticosteroid. So it's typically used to treat people with asthma as what we call a controller or preventative type medication. It's been around since 1994 originally, and then there's been various formulation changes where its current form is Flovent, and that's HFA abbreviation after it. But that's been around since 2004, so it's been with us for quite a long time.
Yeah, so it's a medication that, we've used for decades essentially. And the manufacturer of this brand name Flovent announced that they are going to discontinue production after December 31st, 2023. So very soon after people listen to this, or perhaps it's already happened, depending upon when they listen to it. Why is this happening? Is there something wrong with the medication, or are there other reasons?
Yeah, there's nothing wrong with the medication. So the company that manufactures Flovent announced earlier this year that they're going to produce a generic form. So there's a couple of different ways generic medications become available. So this is a process they call it an authorized generic. So this is when the manufacturer of the medication in question either produces that medication themselves under a generic label, or they authorize another company or license another company to manufacture it on their behalf. So the company that manufactures Flovent announced earlier this year that they would produce this authorized generic form. So there's nothing wrong with the medication. The medication will be exactly the same. The delivery devices will be the same. So I mentioned this HFA inhaler earlier. There's also what they call a discus form of Flovent. So both delivery devices will be produced in this authorized generic manner. Why is it happening? We can somewhat speculate. When companies produce generics through this authorized generic manner, it's usually something to do with the business model of that company. Again, I don't know the specific reasons in this case, but there may be some business reasons why companies would do this. In Flovent's case, or any other medication where this happens, there could be other competing companies that have already released a generic form of the medication, or they're planning to. So the company is trying to address that in the competitive marketplace. So that may
Hmm.
be a reason. The other potential reason here is also business related. Um, During the COVID years, there's what they called a Medicaid rebate cap for medications. So this, without getting onto the business aspects of it, it's a way that uh, the government can keep prices, medication prices, low when they purchase medications. And this cap happens to be expiring at the end of this year. So
Mm.
what that does, it may create an environment where having brand name medication is an expensive proposition for various companies. So to offset that, a generic form is produced. Again, I'm speculating here, but that it's probably an economic reason at the end of it.
No, and I think it's very reassuring, especially for our patients that may be listening, that there's nothing wrong with this medicine. So it's not like they've been harming themselves or their children if they've been using it for this period of time. There are other reasons why it's being discontinued. You mentioned the generic equivalent of fluticasone. Do we know anything about the availability of this? Is this something that will be in short supply, or is it to be determined?
The company that's manufacturing it has announced in several places that there's no anticipated supply shortage.
Hmm.
That there's more than ample supply available, so we don't anticipate any issue with that. Now there may be some issues in terms of availability in the sense of one's health insurance coverage. So
Mm.
when there's a generic equivalent, so a health plan may consider that a completely different medicine than brand name. And so when that happens, there may be some issues with availability in a practical sense.
Hmm. So let's say we have somebody with asthma. They've used this medication for years and years and years. If for some reason they're unable to obtain the generic equivalent fluticasone or it's not covered by their insurance provider, what other options exist for these individuals who have asthma?
There still should be several options. There's many different types of inhaled corticosteroid inhalers. So while it may not be the same brand or the exact same steroid medication used, there should be plenty of other options available that would be under one's health plan. So I wouldn't be too concerned if there's difficulty of obtaining Flovent or its equivalent. Specifically, one's healthcare provider should be able to find something, an equivalent type inhaler that would work just as well.
Uh, we always recommend that for anybody with asthma, they should revisit their treatment plan, ideally at least once a year. And of course, if they have more severe persistent symptoms, then more frequently than that. And I suspect that this is now going to occur out of necessity for those who are currently taking brand name Flovent. But in general, why is it important to periodically review asthma management?
Yeah, that's a great question. I mean, asthma can certainly vary over one's lifetime in terms of the symptoms and severity, and there's lots of external factors that could affect it. One's immediate environment, what they do for work or where they go to school. Is there anything new at home, like a pet, for example? Are there any other medications that one may have started that could affect asthma, or how well certain asthma medications work? So there's lots of things that can make asthma change over a year, And so we need to make sure that the treatment plan that we used last year is still the best plan to use in the coming year.
Hmm. What can you tell us about something called smart therapy, and is that a potential option for some of these individuals?
Yeah, I think that's a great question. In the last few years, there's been a number of new recommendations on how we treat asthma. So one of the biggest changes that have come along is something called SMART therapy. So this is an acronym that stands for single maintenance and reliever therapy. So the idea here is that one would use the same inhaler that you use as maintenance or prevention as you use for your rescue therapy. So for years we had kind of two different sets of inhalers. So one that we would say is maintenance or preventive, and then we had a different inhaler that we would say is your rescue inhaler or your as needed inhaler. And these were kind of two separate classes of medicine. But with this new smart therapy, you would just use the same inhaler for both
Hmm.
purposes. And there are a number of advantages that have been shown in a number of studies where, in the long run, this would decrease your overall exposure to steroid medicines. It would decrease your risk of having severe exacerbations, and improve several outcomes related to asthma. So there's a lot of evidence to support, changing the way we manage asthma with this. So typically, someone who's on Flovent has what we call persistent asthma, where you have symptoms often enough that we would recommend having some type of maintenance or preventive therapy. So it is, a pretty good chance that one could be a candidate for smart therapy, depending on how severe your symptoms are.
Okay. And by no means would I suggest we go from Flovent straight to a biologic, but you've given us multiple different options that people can pursue, including hopefully generic fluticasone. But can you just briefly talk about the role of biologics and when we should consider these treatment options for somebody with asthma?
Yeah, there's a lot of talk about biologics. I'm sure many patients see lots of ads for biologics. Many of my
Mhm.
patients tell me that every day. And I think biologics have really expanded our treatment options for asthma, so they certainly have a role. For those not familiar, these are typically medications that target very specific parts of your immune system that could potentially be playing a large role in your asthma. So we're kind of selectively targeting areas in a very precise way to make someone's asthma better. Uh, we typically reserve these medications for those with more severe symptoms, where you may require multiple medications already to manage your asthma, but you're still having symptoms, or if you're requiring a lot of medications and having a lot of serious side effects from those medications. So we're trying to find alternative treatment regimens for you. These biologics have a number of studies that support that they could certainly reduce your need for other types of asthma medicines and reduce your need for what we call systemic steroid exposure, where one would need, like steroid pills to treat your asthma if that happens frequently. So certainly biologics have their role, but we have to be, very selective and those that we think it may help. They tend to be expensive types of medications. They're not without side effects either that may need to be monitored. But certainly could be a good option for a select group of patients.
What about the other group of patients who may have used this medication, Flovent? So individuals with eosinophilic esophagitis, for instance, who may have been prescribed swallowed Flovent, so they use it without the spacer to treat their condition. What are some other treatment options that exist for these individuals?
Yeah, that's a great question. We think of Flovent usually to treat asthma, but it's been used and studied to be used off-label to treat eosinophilic esophagitis with fairly good results. If Flovent's just not available or its use is restricted, there are other um, steroid inhalers that could be used, although not as well studied as Flovent. But there's another steroid called mometasone that's available as an inhaler. And there's another steroid called cyclosinide that's also available as an inhaler. So these may be other potential options in terms of inhalers where you could still use them to be swallowed, kind of like Flovent. There's also a steroid called budesonide that comes in a liquid form that can be kind of mixed in a certain way where you would swallow that. So there are some other options to treat eosinophilic esophagitis if Flovent's just not available. And briefly, there is a biologic available to treat
Hmm.
eosinophilic esophagitis too, although that's usually reserved for those with more severe symptoms.
Yeah, so that's great. And as you discussed, there's options galore. So this is maybe a great opportunity for people who've been using this particular medication for a long time to revisit this with their personal allergist or physician and discuss other options. The discontinuation of a commonly used medication such as Flovent is relatively rare. I can't think of the last time we've had to deal with something like this. However, something we deal with on a regular basis is when insurance companies change their formularies, either year to year within the same year, and they may no longer cover medication that somebody's been using to treat their chronic condition. How can allergists and clinicians in general help our patients when these changes occur?
Yeah, that's always a very challenging situation that I think all allergists and frankly all health providers share the changes in formularies. We need to work obviously together with our patients to see what is on their formulary. Are there equivalent types of treatments that would be covered on their formulary, and that may take a little investigation to figure that out. It's not always really evident at a clinic visit, but that's certainly it's a team effort here, work between healthcare providers and their patients on a one-to-one level. Certainly, we get some notifications from some health coverage companies about changes in formulary, so that we can be somewhat proactive in that sense if we're notified of such and we have a number of patients that are on that particular health plan or whatnot. And then, more of a global sense, there is a lot of work in terms of state legislation, national legislation, in terms of prior authorizations that the academy has been working on, as well as other large medical professional organizations, trying to lobby Congress to make prior authorization not so onerous.
Mm.
So I think there's a lot of levels to address this, but from one-on-one with our patients to really as a specialty, being active in terms of advocating for our patients, in terms of government and payer relations.
Oh, that's encouraging to hear. No easy answer, but I know the academy and especially folks in the advocacy side of things have been really working tirelessly to help with this. So hopefully we'll see some progress in the future. Well, Dr. Pongdee, so far you've discussed, great options for people to consider if they need to find something to replace their Flovent. And, this really is a great example of shared decision making between a patient and one's personal allergist or other healthcare clinician. Can you offer some thoughts as to what shared decision making entails and how you use this with patients in your practice?
Yeah, that's a very important point. I think for this particular topic, and really just for providing medical care in general. I think allergists are well positioned here. We manage lots of chronic conditions where there may be a number of treatment options to consider. So we need to basically have a partnership with our patients and in the decision-making process with a number of options being available. Making sure that patients have good evidence for the options that are being offered. That we discuss the variety of options available. The risks and benefits of each of those, and really, learning from our patient. What is it that's important for them. So this shared process is not only presenting patients with the evidence information about what's available, but also listening to them about what are their preferences, what are their values, what's important to them in terms of their health care, because that's going to really shape what they want from the treatment being offered. And if we can hopefully have a decision together, what the evidence will show is that there's going to be a lot better outcomes when it happens. So patients are more likely to be adherent to the treatment plan, and their outcomes from treatment will be much improved. So it's really just getting together on the same page, listening to one another. And we strive to do that. I think allergists are well positioned to do that. We take care of lots of conditions where this would apply, and we follow our patients over time. So we get feedback on how their treatment is going, and it's hopefully leads to better care for our patients.
I love that you included that last point, and I couldn't agree more of the long-term relationships we have of, okay, let's come to a decision together. Let's see if it works. If it's achieving the outcomes that we want and meeting your preferences and goals, great, we'll continue it. If it's not, we'll be seeing you back and we can readjust. Absolutely. Well, Dr. Pongdee, so far you've given us a lot of reassurance and outstanding information about some options that people can consider. What would you say to somebody who's just now learning about the discontinuation of Flovent? Is this a chicken little sky is falling moment and they should panic, or are there better steps for them to take?
Yes, that's certainly not time to panic. I think the first step is just learning what's happening, and then having a plan going forward. Certainly here near the end of the year, I would say making sure you have your current refills of Flovent available, or however that looks, so there's not going to be hopefully an interruption in your personal supply. And then likely touching base, with your healthcare provider to address, what are the next steps here as we move into the new year. Because I would say there's probably a number of providers that don't realize this is happening. So again, it's good for patients to be, proactive. Reach out to your provider. What are the steps here? Get that asthma action plan looked at, and see what's the path going forward. I think that can certainly be achieved. And if there's providers out there that this is the first they're hearing of it, then they can also start formulating on their end how to address these changes. What options, if there needs to be a change, that they're comfortable with in terms of other medicines, and probably get some guidance from the health insurance companies that they deal with most in their practice.
That's great advice. We love having all guests from different backgrounds on the podcast, especially when we have leaders from within the organization. And as we wrap up our conversation, would you be okay if I ask some personal questions about your career and involvement within the American Academy of Allergy, Asthma, and Immunology?
Hey, of course.
Yeah, well, thanks. Well, let's start with just, can you describe what you enjoy most about working at an academic medical center?
Yeah, there's a lot of things about being at an academic center that are great. I really like the breadth of medical conditions that I see. So some of my particular interests are conditions that aren't as common as others. So I enjoy being able to see more of those types of patients where I work. And there's certainly the education aspect at academic centers. So I get to be involved with allergy, immunology fellows in training, medical residents, medical students. So that's just a rich atmosphere to kind of keep learning. I learn so much from our trainees. They keep me on my toes to be as up to date as possible, and so that kind of environment is very mentally stimulating, and I think helps keep me younger than my chronological age.
That's great. So you've also been very involved within the academy throughout your career. What would you say is the most fulfilling part of being involved in the organization?
Yeah, it's been great being involved in the academy. I've been involved since I was a fellow in training. I think one of the most rewarding things is just the relationships you make with individuals that I probably otherwise would not have met. So I I have the opportunity to meet other allergists and learn from other allergists, from all across the country, do various activities of the academy, and it's a great learning experience for me to not only knowledge but to grow in a professional manner personally. And it's also fulfilling to be able to give back to the specialty. I think all of us love our career choice, and if there's a way we can make the specialty stronger, no matter what practice setting you're in, and also make sure it's strong for future generations. So we have wonderful trainees and students and researchers who keep pushing the field forward. So we want to make that as strong as possible. So having a small part in that is very fulfilling.
Mm. Well, you're almost halfway through your term of service on the board of directors for the Academy. What's been the most surprising or unexpected thing for you to learn about since you joined the board? Is there, some secret handshake or some, mystical hideaway that you all get together to meet at? Or
Yeah, I can't divulge that in a public manner, but but what I'll say is I'm amazed at how much work gets done behind the scenes. I think from the outside, I mean, I think you kind of think, well, the board and the staff that supports the board at EDI, they're busy, they do lots of things to support the organization and especially, but to see it up close, you have a group of individuals from a lot of different backgrounds and settings. You all come together with the common purpose of, supporting the specialty, supporting the membership, and that's really eye-opening to see. You have this kind of common goal, and there's so much work, especially in terms of the advocacy that you mentioned earlier. There's a lobbying firm that the Academy works with that follows dozens and dozens of bills on Capitol Hill, all related to allergy and immunology in some fashion. And this gets tracked like all the time. And how should we do this? Or how should we do that? And then there's all these interactions with all these other organizations, all to like kind of how can we strengthen our specialty? What can we do here? Because that helps all of our members. So to see that up close is really great to be involved with that, and I don't think, especially the staff at EDI, that supports the board and the academy get enough credit. That they work behind the scenes, and all the board members that put all their time into these kinds of decisions. It's a great group to work with.
Oh, that's wonderful. And I guess along those lines, for members who may be listening now, and let's say they want to get more involved within the academy, but they don't know where to begin. What advice do you have for those individuals?
Yeah, that's a common question, and I think there's lots of different avenues. The academy, sponsors a leadership institute. So there's a program at the annual meeting, and actually a mentoring program for those that are interested. That's one route. I tell many individuals to get involved on the committee level. Much of the work of the academy is committee driven. There's lots of committees that serve various interests. I would hope that there's one particular one that aligns with one's personal interests, and just get involved there. See what that committee is doing. Talk to your committee chair. There's all kinds of projects going on in the academy, and there's lots of need for people to volunteer and do things or have ideas. I think some people are a little worried, like, well, if I join this, or I'm not this or that. But everyone's participation is so welcomed, and sharing of ideas is sorely needed, because that's how we all make it better. And if one of those avenues doesn't work, you can reach out to any committee chair of any committee. You can reach out to any board member. You can reach out to me. I mean, whoever it is, I think anyone who has a leadership position or has held one in the past in the academy is very open to speaking with those who are not quite sure, what to do, how to get started.
I couldn't agree more. And sometimes it really is as simple as sign up, show up, speak up, and you can get involved. That's great. Well, I saved this one for the end on purpose, and our listeners are likely not aware that you, Dr. Pongdee, previously held my position, except you were the website editor, and there was only one of you, and then the Academy decided to split it into two positions where I'm the social media editor and we have Andrew Moore as the website editor. I still remember meeting in the conference room with you, and you handed the reins over about 6 years ago, and if I recall correctly, the idea of the podcast was yours. You proposed this idea, and so we all have you to thank for this tremendous idea. And now that we've passed over 100 episodes, how do you think things are going so far?
Well, I think they're going fantastic. It's very gracious of you to credit me with the idea, but there were a lot of great ideas that were not from me during that time. But there was a time, if one can imagine, when the Academy was not involved in social media at all, and that was like a new concept a number of years ago. And now the Academy is heavily involved, and the podcast idea was one of the last things before I finished my term. But all the credit, really, I think, to you, Dave, and Laura, who you work with. The podcast has been wonderful. It's a great source of information. I can't tell you how many times I've heard accolades for how well it's done, and you and Laura should be congratulated for passing the 100 episodes. I think I know on the board level that was highly celebrated, as I'm sure it was in many places. So actually, for me, I can't thank you enough for making it so successful, because it's made me look good in terms of having an idea.
Yeah, well, thanks, Thanai. No, like you said, it's a team effort. It's always nice just to be given the opportunity. And for our listeners, that was called fishing for an easy compliment, because, yeah, I just teed it up for you. So, no, thank you very much. And it's nice to have you on the podcast. And really, you built the platform that Andrew and I have been able to build upon. So thanks for your service in that realm as well. Um, Dr. Pongdee, this has been a great conversation. I'm sure our listeners are going to benefit from the information you provided. Is there anything else you'd like to add?
No, this has been a wonderful experience. Thanks again for having me. I just want to echo to those members who want to get involved in the academy. Please reach out and do so. The academy desperately needs your involvement to keep our specialty strong. So that would be my main takeaway in that regard.
Excellent. Well, thank you again. We hope you enjoyed listening to today's episode. Please visit www.faaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.